To Nursing Prep, push yourself in nursing preparation with smart way. The topic is physiological integrity. A patient is prescribed a new medication for the treatment of hypertension. While supine, the patient's blood pressure is 112/70ths of a millimeter of mercury and the heart rate is 80/minute. The healthcare provider assesses the patient when the patient changes to a sitting position. Which of the following indicates the patient is experiencing orthostatic hypotension? Option A. BP 88/60, HR 100. Option B. BP 90/60, HR 68. Option C. BP 120/84, HR 82. Option D. BP 166, HR 90. Right answer is Option A. BP 88/60, HR 100. Orthostatic, or postural, hypotension is defined as a decrease of more than 20 mm of mercury systolic or more than 10 mm of mercury diastolic and a 10% to 20% increase in heart rate. It results when the patient's blood pressure is not maintained during position changes, i.e. from lying to either sitting or standing. The healthcare provider is assessing a patient recovering from a total knee replacement. Which of these assessment findings indicates the patient is at risk of developing a complication from the surgery? Option A. Incision site edema. Option B. Pale toenail beds. Option C. Hormone sign negative. Option D. Hemoglobin 12.5 grams/dl. Right answer is Option B. Pale toenail beds. Pale nail beds of the toes indicate neurovascular damage. Other signs of neurovascular dysfunction in an extremity include diminished or absent pedal pulses, capillary refill in toes greater than 3 seconds, inability to flex or extend the knee, foot, or toes, numbness or tingling in the foot. Edema should be monitored but is an expected finding during the initial recovery period. A negative hormone sign is part of an expected assessment finding if the patient is not experiencing a deep vein thrombosis. Lyme disease should be treated promptly. When a patient presents to the emergency department with symptoms related to Lyme disease, which should be prescribed? Option A. Famotidine. Option B. Simvastatin. Option C. Doxycycline. Option D. Enalapril. Right answer is Option C. Doxycycline. Doxycycline and amoxicillin are the usual prescriptions for Lyme disease. Enalapril, Vasotec, is prescribed for hypertension and congestive heart failure. Famotidine, Pepcid, is used for gastrointestinal disorders. Simvastatin, Zocor, reduces cholesterol. The healthcare provider is preparing a patient on the medical surgical unit for a thoracentesis. Which of the following is the most appropriate position for the patient during the procedure? Option A. Sitting up, leaning over a bedside table and feet supported on the ground or stool. Option B. The head of bed elevated 45 degrees with the patient lying on the affected side. Option C. The head of the bed flat with the patient lying on the unaffected side. Option D. Prone, with both arms extended above the head. Right answer is Option A. Sitting up, leaning over a bedside table and feet supported on the ground or stool. A thoracentesis is performed to remove fluid or air from around the lungs, perform a biopsy, or administer medication into the pleural space. The patient should be sitting up, leaning over a bedside table with arms rested, feet supported on the ground or stool so the needle can be inserted appropriately. The point of entry is from the back of the patient. The healthcare provider is performing an assessment on a patient who is taking propranolol, Inderal, for supraventricular tachycardia. Which assessment finding is an indication the patient is experiencing an adverse effect of this drug? Option A. Bradycardia. Option B. Dry mouth. Option C. Urinary retention. Option D. Paresthesia. Right answer is option A. Bradycardia. Beta-1 receptors are found in the cardiac conduction system and myocytes. Beta-1 blockade will slow discharge from the SA node and decrease speed through the AV node, slowing the heart rate. Propranolol, Inderal, decreases the strength of heart contractions, as well as the heart rate, resulting in less cardiac oxygen consumption. The healthcare provider is assisting during the insertion of a pulmonary artery catheter. Which of these, if assessed in the patient, would indicate the patient is experiencing a complication from the catheter insertion? Option A. Vesicular breath sounds noted on auscultation. Option B. Inspiration phase is greater than expiration. Option C. Diaphragmatic excursion of 3 cm. Option D. Tracheal deviation from midline. Right answer is option D. Tracheal deviation from midline. Tracheal deviation from midline is associated with a tension pneumothorax, which is a potential complication associated with central line insertion, caused by a collection of air between the chest cavity and the lung. Inspiration phase is normally greater than expiration, but it may also be noted in pneumothorax. Vesicular breath sounds are a normal finding. Diaphragmatic excursion of 3 cm is a normal finding. A patient receiving vancomycin has an order for a trough level to be drawn. When should the lab collect the blood sample? Option A. 1 hour before the infusion. Option B. 30 minutes before the infusion. Option C. 1 hour after the infusion. Option D. 30 minutes after the infusion. Right answer is option B. 30 minutes before the infusion. A trough level should be drawn 30 minutes before the 3rd or 4th dose. The other answers are incorrect times to draw blood levels. Since vancomycin is indicated for serious gram-positive bacterial infections, monitoring levels is important. Typical trough level range for vancomycin is 10 to 20 micrograms per milliliter. The reference range for peak levels is 25 to 50 micrograms per milliliter. A patient is taking daily low-dose aspirin and experiences prolonged bleeding from a superficial cut. Which of the following lab results would be expected for this patient? Option A. Activated partial thromboplastin time, up to 30 seconds. Option B. Platelets 150 by 10 to the power of 9/L. Option C. Prothrombin time, PT 14 seconds. Option D. Bleeding time of 8 minutes. Right answer is option D. Bleeding time of 8 minutes. During primary hemostasis, a platelet plug is formed. Clotting factors are involved in secondary hemostasis, coagulation. Both UPT and PT measure the coagulation pathways. Aspirin inhibits cyclooxygenase, COX, which promotes the synthesis of TXA_2. Because TXA_2 is necessary for platelet aggregation, primary hemostasis is inhibited. This is measured by bleeding time. Platelet activity is affected, but not the number of platelets. A patient is brought to the emergency department, ED, by a friend. The patient is unresponsive and respirations are slow and shallow. Which of the following is the priority intervention? Option A. Ask the friend if they were using illicit drugs. Option B. Administer 100% oxygen per nasal cannula. Option C. Administer naloxone, per protocol. Option D. Check the patient's blood glucose level. Right answer is option B. Administer 100% oxygen per nasal cannula. Because the patient is showing signs of impaired respirations, the priority intervention is to administer oxygen and support respirations. Use the ABCs, airway, breathing, circulation, to determine the priority action. Asking more about the patient's history can then be done. Is the patient diabetic? What drugs involved? Does the patient have a respiratory condition? Information will be helpful in determining emergency treatment and directing the patient's continuing care. Following a myocardial infarction, the nurse assesses the patient's electrocardiogram strip shown in the image. The nurse identifies the rhythm as Option A. Sinus bradycardia. Option B. Atrial fibrillation. Option C. Ventricular fibrillation. Option D. Sinus tachycardia. Right answer is Option D. Sinus tachycardia. Sinus tachycardia is a rate over 100 bpm. The conduction and rhythm are normal. The AP wave precedes the QRS, which is usually normal. Following a myocardial infarction, sinus tachycardia should be quickly assessed and treated. Thanks for watching. If you like our video, then do like, comment, share. Subscribe our channel for regular updates.